Thank you for the invitation. So my intention is to talk a little bit about artificial intelligence for clinical decision making. What are the challenges? What can we do? Bart Benens from Barcelona, Spain. So when we use echocardiography for clinical decision making, we know that actually we have to integrate quite a lot of data. And actually it's very complex data that very often we try to recognize patterns in a combination of what we see on the grayscale images, where we sometimes do some analysis like deformation, for example. We definitely should integrate hemodynamic data from Dopplers. And what we need to do is use all this information in order to make a decision regarding a patient, whether it's diagnosis or prognosis or whatever. What we do in clinical practice is either use this as a pattern recognition, and then additionally we do measurements, or we just do the measurements, and based on the measurements together with some guidelines, we make a decision. But this obviously needs clinical experience, and also depending on which are the parameters that we would use in the decision making, we might be limited and we might actually be missing information. So the question is whether machine learning and artificial intelligence can actually help in order to make this more reliable, more efficient, and more reproducible in some ways. And I think what is really important is that we understand how we make decisions. And actually, as a human, we're very good at decision making, but actually we use two different ways in order to decision making. And one is what we call type 1 decision making, which really is trying to recognize patterns, and which is very intuitive, which is very fast, which we are actually very, very good at, but which also has limitations. And for example, when we use this for clinical decision making, here, for example, is a study that they did where they gave radiologists CT thorax images where there was actually a gorilla embedded in the images, and they asked to make a report based on these images. And most of the radiologists, actually 80% of the radiologists, did not see that there was a gorilla in there, because what they actually did is they used their pattern recognition skills to try to recognize the things that they have learned. So, but on the other hand, what we should do actually in order to not miss this type of things is use type 2 reasoning, which is really analytical deductive. It's really saying like, okay, this is the image. What do I see on the image? What is there, rather than just recognizing things. And just knowing that there's two of these ways of doing it, with one being efficient, but with potential errors, and one being much slower, but much more rationalized. This is important to know also how we can try to translate this into artificial intelligence, because many of the tools that we actually use are more this type 1 decision making with its potential problems. And when we talk about artificial intelligence, actually, we're not talking about one method. There's actually a whole bunch of methodologies, and actually even robotics is what falling under artificial intelligence, what we say. But very often what we do use is some machine learning techniques. And again, there are very, very many algorithms. We're not going to go in detail now, but the most known is actually deep learning. Now, when we also choose for using artificial intelligence for clinical decision making, I think it's also important to realize or recognize where we make errors in clinical decision making. And actually, one of the problems is underinterpretation of the findings, which is actually using this type 1 reasoning, as I tried to explain before. The other thing is technical factors, where again, if we can use artificial intelligence in order to improve our acquisition, then actually we would be beneficial and try to avoid some of this. And even incomplete examinations are partially related to this in the combination in it, that is a combination of technical factors together with potential underinterpretation, where again, we use this type 1 recognition as once we find something, we're not going to look further. Now, in order to really do it properly, what I think we need to do is go back to the basics and see how we actually make decisions in medicine. And that is actually when a patient comes to us, what we do is we do, first of all, data acquisition, where we acquire data, and then we do measurements of these data. And the combination of these measurements, what we do is we try to use this to create in our mind a state of this patient. And based on this state, integrating all the information that we have, we try to do an interpretation, which actually means that we compare it to a certain population of disease, population with a certain diagnosis, population with a certain prognosis, or a certain therapy that is needed, keeping in mind uncertainty and reliability of the data. This we use for decision-making, and decision-making can be, we either do an intervention, we say we need more data to make a proper decision, or for example, we do watchful waiting for the patient. And we iterate in this. All of these different components have different requirements, and we maybe can use different techniques in order to do it. As I said before, when we talk about imaging and artificial intelligence, we very often talk about deep learning, and actually that has been developed for image interpretation, but for photographic image interpretation. And this is very, very powerful. Can that be used for echocardiography? Well, yes, obviously, and we see already some of these things in clinical practice, namely that most of the manufacturers have added this type of machine learning for feature extraction, for automated measurements on our machines. Now, to use this for decision-making and for diagnosis, we have to be very careful, because here, for example, is a study that is very good at recognizing hypertrophic cardiomyopathy, but if it hasn't been trained for dilated cardiomyopathy, for example, it would classify this as normal. So again, this is this type 1 interpretation where we have to be very, very careful on how to use it. So what should we do? Well, actually, we should see at the data that we're using, and we try to integrate data, and we can find ways in order to do that. Then in order to compare or interpret the state of the patient by comparing them to different populations, this is quite useful. Based on this, we can actually make a disease spectrum from healthy to diseased, which can be related to risk factors, for example, and which we then can relate to treatment. And all of this, we can use artificial intelligence in order to do this. And just as an example, this is a way that we could interpret it. For example, what we can do is we can take the complex data of patients, and based on this, we could actually rank patients, position patients with regard to each other. And then we can see, for example, that we would have normals or hypertrophic cardiomyopathies based on the complex information that we can do so. And just as an example, I would like to finish off with showing you a study on pediatric dilated cardiomyopathy, where you use hemodynamics and you use deformation. Then you do machine learning in order to combine this information with some also things like age and so on. And then afterwards, you try to interpret this. And what you can see there is if you would position these patients with regard to the data that you're using, what you actually see is that there's different clusters of patients. And what you can notice is that there's clearly two clusters with very high incidence of death and transplant, for example. And when you look at the data, what you see is that it has abnormal outflow, it has decreased ejection times, it has altered diastolic function, it has reduced strains potentially. And what we see there is that we find the cluster of systolic heart failure and one, for example, of diastolic heart failure. So what is important is that AI offers an opportunity for personalized medicine that can be used for data acquisition, feature extraction, information integration, and interpretation. Thank you very much.